8:13. Quickly to Dr. B, Dr. Brent Wallis from People's Health, Chief Medical Officer. Good morning, Doc. How are you?
Hey, Tommy. I'm doing great. How about you?
Great, beautiful day outside. And today we're going to talk about, I don't think this just applies to senior health. I think this applies to everybody. Shingles. 1 in 3 adults going to get them in their lifetime. But it's a largely preventable condition. Dr. B from People's Health is going to tell us how to recognize shingles and talk about them. First of all, Doc, I've had them, but for people that don't know, what is shingles?
Yeah, sure. So shingles, or some people may call them herpes zoster, is really just a reactivation of a viral disease, and it causes a really painful, usually unilateral rash. So it's usually on one side of either your body, your torso, maybe the side of your face, or even your head.
What causes them?
So shingles are caused by the same virus that causes chickenpox, and that virus is called varicella zoster. And once that virus gets inside your body, the first thing it would do, the first time you're exposed to it, is it would cause chickenpox. And then after that runs its course, the virus actually moves into the nerve tissues and actually sets up shop there and stays dormant, usually for life. But for 1 out of 3 people, sometimes that virus can reactivate, and it can actually cause shingles. And, it's typically because of maybe a compromised immune system or maybe a weakened immune system, but there are other things that can kind of trigger this reactivation that causes shingles.
Stress?
Yeah, stress definitely does it, and we see that quite often, especially stressful times around the city and stuff like that. We'll have a flare-up of shingles.
I can feel when it's coming on, and inevitably when I do, I realize that I'm under a lot of stress. Who is at the highest risk for shingles, Doc?
Well, really, anyone who's had chickenpox is going to be at risk for shingles, and it's regardless of your age or health status, but the incidence does increase with age, and that's usually because your immune system starts to slow down a little bit as you get older. About 1 million people in the United States get shingles every year, and about half of those cases are in adults that are 60 and older.
What are some of the symptoms for people that have never had it?
Yeah, so if you've never had it...
I say that because if you had, you know what they are, right?
Yeah, you know exactly. Yeah, if you've never had it, you don't want to have these symptoms. But if you start having this, it's something you want to take care of right away. It usually starts with a painful and a burning sensation. It usually develops on one side of the face or the body. And you may actually feel that pain or itching. People describe it sometimes as tingling in the area where the rash is going to develop before the rash even appears. You may have some other symptoms too. People typically will have a low-grade fever or some headaches. Some people, it can be a little more severe. They can have chills or even muscle weakness, maybe even an upset stomach and some fatigue. So pretty severe symptoms if you do get shingles.
What do you do if you have them?
Yeah, so absolutely. If you think you might have shingles, you want to talk to your doctor right away. And one of the biggest reasons for that is we do have some medications that can be used to treat shingles, but you really need to start them usually within about 3 days of getting the rash, because they don't work real well if you start taking them after you've had the rash for a couple of days. Normally if you come to see us, we can diagnose shingles just through an exam. It's pretty characteristic look of the rash in particular. And we may, on occasion, though, order a shingles test. And there's both a blood test we can do, or if you have a blister from the rash, we can actually do a sample of the liquid within that blister, send it off to the lab, and we can confirm. The only time that we'll send a test is usually if you're unsure if you had chickenpox when you were younger or the vaccine when you were younger, if you're having kind of atypical or abnormal symptoms that don't fit the classic characteristics of shingles, or if you're real high risk for complications, then we're going to send it off just to confirm it.
How do you treat shingles?
So, like I mentioned, there are some drugs that we can use to treat the shingles viral infection itself, and those are antiviral drugs. But like I said, you have to start them within 3 days of having the rash. If you start them after that, they're usually not going to help all that much. There are some over-the-counter medications you can talk to your doctor about to relieve some of that pain. There are even some prescription medicines sometimes we have to use for that burning and tingling if it gets really bad. And then the other thing is really to treat the rash itself. Wet compresses, calamine lotion is wonderful. Oatmeal baths can really relieve the itching and the pain that you're having.
Doesn't matter what flavor of oatmeal, Doc? Just kidding.
Not at all.
How long does an outbreak last generally?
So most cases of shingles last really about 3 to 5 weeks. So it's a pretty long duration. The first sign of shingles, like I mentioned, is that burning or tingling, sometimes a little bit of itching or numbness. And about 1 to 5 days after that starts, usually the rash will appear. And then a few days later, the rash really erupts and becomes these fluid-filled blisters. If you've ever seen chickenpox, it looks very similar to chickenpox. It's just not all over your body. It's usually in a smaller distribution around your body. And then those blisters dry up and they crust over, usually about a week to 10 days later. And then about 2 weeks after that, the scabs will finally clear up. So pretty long duration.
Any long-term effects?
Yeah, I mean, it depends. For a lot of people, shingles goes away in 3 to 5 weeks and they don't have any problems at all. But about 1 in 5 people have pain in particular that can last a lot longer. Sometimes up to a year, maybe 2 years. That pain actually is called post-herpetic neuralgia. And really severe shingles can cause that lasting nerve pain, even cause some nerve damage or scarring. And, shingles can develop on the face, in particular around the eye. And actually, if it affects your eye, it can actually cause permanent vision loss. So that's why it's so important if you have a rash on your face to see the doctor right away. The other thing is if you get it more around your ear area, you can actually develop some long-term hearing loss. So in particular, if your pain is continuing after the rash has healed up, or if you're having any other longer-term symptoms, you want to talk to your doctor to see how you can treat those.
All right, when we come back, we'll talk about shingles being contagious, about protecting yourself, about the shingles vaccine. I got a lot of questions coming in via the text line. I'll try to get them to them as well. We're talking to Dr. B, our friend, Dr. Brent Wallis, Chief Medical Officer of People's Health, about shingles. 8:20 and a half, time for traffic now on WWL. 8:25, Tommy Tucker, WWL. Quickly back to Dr. B, Dr. Brent Wallis, Chief Medical Officer at People's Health. We're talking about shingles. Doc, is shingles contagious?
Yeah, it's a good question. Technically, shingles itself cannot spread from person to person. But keep in mind, because shingles is caused by that chickenpox virus, what happens is if you have active shingles, in particular with those active blisters, you can actually spread the chickenpox virus. And so you have to be really careful about going around people who maybe haven't had chickenpox, or they're not sure if they did when they were younger, or they never received the chickenpox vaccine. And keep in mind, fewer people, unfortunately, are getting the chickenpox vaccine, and so people could be at risk. You in particular, really want to avoid any newborn babies, any pregnant women, and then definitely anybody with a weakened immune system, maybe somebody receiving treatment for cancer, somebody with diabetes, because they actually could get chickenpox from your shingles.
Direct contact or from like breathing, respiratory, sneezing, that kind of thing?
Yeah, it can actually be both, because you've got the virus around in your system, and so you can spread it pretty easily. But in particular, if you keep those blisters covered up until they get to the crusting phase, you're much less likely to spread to someone.
So how do you protect yourself? And let's talk about the shingles vaccine. Who should get it?
Yeah, so the absolute best thing to do to protect yourself is to get vaccinated. We have a very safe and effective vaccine called Shingles. It's widely available. Usually doctors can provide it to you. All pharmacies have it as well. And it's about 90% effective at preventing shingles, and in particular those long-term complications of shingles. And really the CDC recommends anyone who's 50 or older who's a healthy adult should get that Shingles vaccine. But in addition to that, anybody who's 19 or older who may have a weakened immune system, they really should probably be vaccinated as well. So talk to your doctor, because they can tell you if it's really right for you.
Is it something where they can't give it to you if you have an outbreak? Is that accurate or not?
Yeah, I mean, if you're in an active outbreak, they'll wait. But actually, if you've had shingles in the past, don't think you don't need the vaccine, because unfortunately, people can get shingles multiple times, and if you've had it once, you don't want to have it a second time. So if you've had it once you're beyond the initial phase, talk to your doctor about getting vaccinated so you can prevent a future occurrence of shingles.
Somebody texted this in several times, Doc, so let me get to it. Tommy, I'm a 68-year-old male in relatively good health. I've had shingles twice, once in the 70s around my waist, then 5 years ago around my eye. Should I get the vaccine at this point? Please ask the doctor. I am listening.
Yeah, absolutely. If you've had it twice, you don't want to get it a third time. So I would go to your doctor and talk about the risk and benefit. But in general, definitely you want to get vaccinated, even if you've had it before.
Somebody else said they caught shingles from their father, thought it was poison ivy, caught it treating his blisters with poison ivy medicine. So you never know. You got to be careful, right?
You have to be careful, but typically it's not spread from person to person. But what we do see occasionally is someone will get shingles, and then someone else in that household may get it as well. It may be the same stressors that they're going through. Like you said, it can be triggered by stress, definitely.
Somebody texted in about oral medications during an outbreak. Is there such a thing?
Yeah, there are. The antiviral medications that we use are all oral, and those are the ones you have to take, remember, starting 3 days after your symptoms, no later than that.
Another text pops up. What are the medicines?
So the medicines in particular we use is one called valacyclovir, and another one is called acyclovir. So pretty typical antiviral drugs we use for a lot of different conditions.
And once you've gotten the vaccine, do you need to get it again ever or not?
No, right now all the studies are showing that one dose of the vaccine is usually good. Now that can change as more information comes out, or people are living longer and longer. So we'll have to see. But for now, one dose usually will do you.
Real quick, Doc, let me get this one in too. If you get the vaccine, should you stay away from babies and pregnant women for a while?
No, usually the vaccine itself does not cause any problems, so you should be fine in that case. It's really if you did develop a rash or any sort of blistering after a vaccine, talk to your doctor, and you probably want to avoid babies at that point.
Very valuable information. Thanks, Dr. B. Appreciate your time.
Thanks, Tommy. Talk soon.
Got that opening in the foursome whenever you're ready.
All right.
To find out more about People's Health, you can go to peopleshealth.com. It is Medicare open enrollment season. We were there last week. The People's Health Medicare Center, 3917 Vets in Metairie next to Party City. Appointments are recommended, but they do welcome walk-ins. It's a nice facility. It'll sit down, talk to you, and take as long as it needs to explain to you how Medicare works. You can call 1-800-978-9765, and you can follow People's Health on Facebook, Twitter, and Instagram. A minute late, 8:31, time for WWL First News. For that, we go to Ian Ozan.